Welcome back from the break. Now, we'll shortly take you to the Volta region where the elders of Nogopo are giving Archbishop Ajanasare 14 days to appear before them. Else, they would also advise themselves. We have a poll on our Facebook page, Joy News. We're asking, should he honor the invitation or not? Some of you have already started commenting. Go there and share your viewpoint. We'll share that with the rest of our viewers. But in the meantime, over 25 million Ghanaians, including 8 million children, have benefited from 370,000 medical deliveries made through the services of Zipline within the last 4 years. In April 2019, government went into a PPP arrangement with the technology firm to supply life-saving medical supplies to hard-to-reach parts of the country. Marking its 4th year at Omenako on Thursday, the company's impact has been described by stakeholders as phenomenal. Carlos Caloni of Joy News has more.
With 27 drones and an average of 95 deliveries in a day, Zipline, which started its operations in 2019, now supplies 2,700 health facilities in hard-to-reach communities with over 5 million units of life-saving medical supplies such as vaccines and blood. Marking its 4th year anniversary on Thursday, June 1, the manager of health systems at Zipline, Kwesi Entry, touched on strict operational processes from observance of personal hygiene at the facility through shelving of drugs and vaccines, processing of orders to how the drones are finally launched for delivery. General Manager of Zipline Ghana, Mauli Atiemo, noted the company would continue to expand its services through strategic partnerships.
Since our launch in April 2019, the partnership has made significant strides in revolutionizing the healthcare sector in Ghana. Our cutting-edge drone technology has enabled us to deliver essential medical supplies, including COVID-19 immunizations, blood products, animal health commodities, and other health-saving drugs to 2,700 health facilities throughout the country. To date, Zipline has completed an impressive 370,000 deliveries of medical products, blood supplies, vaccines, and animal health commodities. We continue to leverage on our cutting-edge technology to enhance our logistic capabilities and forge new partnerships to reach even more communities and ensure no one is left behind.
Speaking at the event, the Deputy Minister of Health, Asesini, said the partnership between Zipline and the Ministry of Health is a shining example worth extending to other sectors.
Through this partnership, we have made Ghana a global leader in the use of drones for medical logistics. We must, as a nation, begin to look at the capacities of unmanned aerial vehicles extending beyond healthcare and ways to solve problems in other industries.
Excited at Zipline's impact in 4 years, especially during the height of the COVID-19 pandemic, the U.S. Ambassador, Virginia Palmer, noted bilateral arrangements are in place between Ghana and the U.S. aimed at scaling up access to quality health care for all.
None of us imagined the COVID vaccine or the COVID pandemic when Zipline was being founded. And the tremendous impact you made in getting those vaccines out to people so that they could resume their ordinary lives is enormous. The United States government is working with you to build on these successes. The U.S. Trade and Development Agency signed a grant with Zipline earlier this year to fund a feasibility study to develop the infrastructure for the rapid delivery via drones of medicine and commercial goods across Ghana and West Africa.
Speaking to the press on the sideline, the general manager added that even though technology adoption rate has been one of the company's biggest challenges, it is poised to venturing into other sectors.
Generally, the challenges has been adoption to technology and the fact that it's something new that has not been seen anywhere. So where the questions about whether it really will work or not, now it's all for us to see that it's really working. So in terms of diversification, we're currently exploring other avenues such as agriculture. So we are looking at vaccination. We currently are doing vaccination in humans. We are looking to do vaccination in animals as well. So we are currently working with the Veterinary Services Directorate in a pilot to explore the possibilities of vaccination for poultry, for example, ruminants and other things.
From Zipline, Omenako, Carlos Caloni, Joy News.
Well, Well, now joining us on Zoom is country lead for Zipline, Samuel Akufo. Grateful to you for joining us, Mr. Akufo. Look, I went to a community very far from here, and I saw that community really taught me the impact of your work. How would you describe your impact in general in 4 years since you've been in Ghana?
Thank you so much for bringing us on. I think the last 4 years have been really amazing. We started with one distribution center. Now we have 6 distribution centers across the whole country, and we have 7 facilities that are in very hard to reach areas. So far, we've done about 370,000 deliveries, delivered millions of doses of vaccines to health facilities in hard to reach areas. And we're currently serving about 60% of the geography in Ghana, which is about 2,700 health facilities. I think it's been amazing because lots of facilities are found in very hard to reach areas where it's not very motorable, right? Some are in island areas, some are on mountainous areas. And the regular ground logistics may not be sufficient all the time to be able to help them be able to receive their medications on time. And so the partnership with the Ministry of Health and Ghana Health Service has been a very collaborative one, which has allowed us to be able to extend this kind of service to those who are particularly in the very hard to reach areas, island locations, who would ordinarily have used boats to cross rivers and go through a lot of stress to get medications. I think in the last 4 years, our impact has been good. We've been able to serve a lot of health facilities who are in hard to reach areas, and the few studies that we've done so far have shown that with the use of our service, a lot of lives are being saved.
Okay. I think that for people of Jantrakrom, where I went, very far from here, very far from even Asankragwa, and that taught me that really you guys are doing some marvelous work. But in all of that, because when I was even driving to this community, I told myself I'll never drive my car here. I guess there are challenges that you guys have been faced with. What are some of those, and how are you overcoming these challenges?
I think the biggest challenge that we faced was the fact that the technology is a novel one, and most people did not have full understanding of what it was when we were starting. And so initially it seemed like that understanding was not there, and so people were not really, there was that level of resistance, which is okay for a new technology. But with the collaboration that we had with Ghana Health Service and the Ministry of Health, as I said earlier on, it was very collaborative to the point that we were able to integrate our services within the healthcare supply chain in a very, even though it was challenging, it was successful in the sense that all the parties that were had interests in what we're doing, stakeholders, were very forthcoming, and they were available to engage, they were open to engage. Even the communities that we were serving, the chiefs, the police, the immigration, the DCEs, all of them were playing major parts, and we're also continually engaging. I think the continuous engagement that we focused on was what really helped us, so that we can be able to dispel all fears and all misunderstandings around what a drone is, because I'm assuming that if your grandmother sees a drone coming to her community, dropping a package, it seems a bit strange. But over time, I think people have gotten used to seeing the drone, and they now appreciate what the drone carries in its belly and what it's there to do, and people now understand it. So I think that challenge over time has gradually waned off, and I think we are beginning to see a lot more impact there.
What does the next 4 years look like for Zipline?
Yes, so the next 4 years would be really amazing in the sense that we are going to get even more innovative. Continuous improvement is one of our main values, where we don't sit on our laurels and hope that because we are doing great, we'll stay that way. No, we are continually improving, taking feedback from our customers, and we are improving our service. Now we are delivering human vaccines, blood products, medical products. In the next 4 years, we are hoping to get into more newer use cases like animal health, supporting the distribution of vaccines even in animal health. We are also exploring the use of drones even within the urban spaces, to the point that in the next few years, it wouldn't be so strange to have a home delivery, where if you have a bedridden patient who is unable to go to the hospital, they can actually receive the medication at their home. So there's the likelihood of seeing a lot more of these innovations in the next 4 years. But we are very much committed to ensuring that the healthcare supply chain that we are working to integrate in, we are fully committed to continue improving the service that we are providing, so that we can even do much more for the people of Ghana.
All right, incredible. And I guess this incredible work is also bringing you the sort of revenue that you should be expecting. I mean, once you're working, you expect to break even for your company. Are you there yet, or you are somewhere far off?
Well, I think the people of Ghana have been great. I think Ministry of Health has been very supportive, and we are very grateful for the support we've gotten so far. Yeah.
Okay. All right then. With this, your home delivery, I guess I'm told it's something you've even started to do some trials on, or that's not it?
Well, we are in the phase of doing some trials. We are still trying to look at the model. We are working with certain key stakeholders within the health space to sort of look at it from a research point of view, and so that we can be able to gather the right level of data to scale it, right? Okay. So it's still at the pilot phase. And so it's something that we know that it would have a lot of value, right? But we also want to do it the right way. That's why we are working with experts within the health space, who are people who work in Ghana here, health, the regional directors and all these key stakeholders, to make sure that the real purpose for which we are bringing it is achieved. Okay. And then the expected outcomes are also achieved before we decide to even scale it onto like a bigger scale. Yeah.
Okay. All right then. Grateful to you. We are expecting that for those of us whose villages you don't have the Zipline services getting there, please kindly get there so that we can also enjoy them in our small communities when we do travel. And those of us who are already there will keep enjoying them.